Good morning, everyone. Thank you so much for being here today. I'm Dr. Crisanto, and I've been practicing neurology for the past 22 years. In that time, I've witnessed something that fundamentally changed how I approach my work with patients. I've seen lives transformed in an instant, families shattered without warning, and I've also seen remarkable recoveries when people understood one critical thing that a stroke often announces itself before it strikes. Today, I want to talk to you about something that could literally be the difference between life and death. I want to talk about the warning signs that your body might be sending you 24 hours before a major stroke occurs. And I want to be absolutely clear from the start. This is not information meant to frighten you. This is knowledge meant to empower you. This is information that could save your life or the life of someone you love. Think about this for a moment. Every 40 seconds, someone in the United States suffers a stroke. Every 4 minutes, someone dies from one. But here's what most people don't know, and this is crucial. Many of those strokes don't come out of nowhere. Your body is remarkably intelligent. It communicates with you constantly. The problem is that we've become so disconnected from listening to our bodies that we miss these signals. We dismiss them as coincidence or stress or nothing serious. And that dismissal could cost us everything. I've had patients come into my emergency department after a stroke, and when I ask them if they noticed anything unusual in the days before, they often say yes. Yes, they had noticed something. They felt strange. Something was off. But they didn't think it was serious enough to warrant medical attention. They didn't know that what they were experiencing might have been their body's way of sending an SOS signal. And that realization, that they missed an opportunity to prevent a catastrophic event, is something that haunts many of them during their recovery. So let me ask you directly, would you want to know if your body was warning you? Would you want that information if it meant you could take action before something terrible happens? I absolutely know the answer, which is why I'm here today. I'm going to walk you through the subtle and not so subtle signs that often appear in the 24 hours before a stroke. I'm going to help you understand what's happening in your body when these signs appear. And I'm going to give you actionable information that you can use to protect yourself and your loved ones. Let me start by explaining what a stroke actually is, because understanding the mechanism will help you understand why these warning signs occur. A stroke happens when blood flow to your brain is blocked or significantly reduced. Now, there are two main types. The first, and by far the most common, is an ischemic stroke, which accounts for about 85% of all strokes. This occurs when a blood clot blocks an artery in your brain. The second type is a hemorrhagic stroke, which happens when a blood vessel ruptures and bleeds into the brain. Now, the warning signs I'm going to discuss today can precede either type, though they're slightly more common before ischemic strokes. Here's what's important to understand. In the hours and sometimes days before a major stroke, your brain is experiencing what we call a transient ischemic attack, or TIA. This is sometimes referred to as a mini-stroke or a warning stroke. During a TIA, blood flow to part of your brain is temporarily reduced but not completely blocked. This causes symptoms that can be frightening and unusual, but they typically resolve within minutes to hours. Now, here's the critical part. A TIA is one of the strongest predictors of a future major stroke. It's like your body is waving a red flag saying, "Hey, pay attention, something is going on here." The first warning sign I want to discuss is sudden weakness or numbness, particularly on one side of the body. This is one of the most common precursors to a stroke, and it's something I see all the time. You might notice that your arm feels heavy or tingly. Your leg might feel numb or weak. Your face might droop slightly on one side. You might notice that you're having trouble gripping things with one hand. The key word here is sudden. This isn't a gradual thing that develops over days or weeks. This is something that happens acutely, and it's often frightening because people don't know what's causing it. I want to tell you about a patient of mine named Sarah. Sarah came into my office about 3 years ago because she had experienced sudden numbness in her left arm that lasted for about 20 minutes before completely resolving. She almost didn't come in because the symptom went away. She thought maybe she had slept on her arm wrong or something silly, but thank goodness she decided to be cautious and schedule an appointment. We ran some tests, found that she had a partially blocked carotid artery, and we were able to intervene before a major stroke occurred. Sarah didn't have a debilitating stroke that day because she recognized a warning sign and acted on it. She's alive and healthy today, and she can tell you herself that those 20 minutes of numbness were the best alarm bell she never expected to ring. The second warning sign is sudden difficulty speaking or slurred speech. This is fascinating from a neurological perspective because it tells us exactly what's happening in your brain. Speech is controlled by a very specific area on the left side of your brain, in most people, called Broca's area. When blood flow to this area is compromised, your speech becomes affected. You might find that you can't form your words properly. You might sound like you've had a few drinks even though you haven't. You might know what you want to say, but the words just won't come out right. Or conversely, you might have trouble understanding what other people are saying to you. This is called receptive aphasia, and it's just as important to recognize. I've had patients describe this experience as incredibly frustrating and frightening. Imagine knowing exactly what you want to communicate, but your brain won't cooperate. Imagine hearing your partner speaking to you, but the words don't make sense. That's what's happening during these warning signs, and it's your body telling you that blood flow to your language centers has been interrupted. This is not something to ignore. This is not something to wait out. The third warning sign is sudden vision changes. This might include blurred vision in one or both eyes, sudden loss of vision in one eye, or seeing double. Some people describe it as a curtain being pulled down over one eye. Others say it's like looking through a foggy lens. This occurs because the blood vessels that supply your eyes and the parts of your brain responsible for vision are being affected. When I see a patient who reports sudden vision changes, my antennae go up immediately. I know this is a significant symptom that requires urgent attention. I had a patient named Robert who noticed that he suddenly couldn't see out of his right eye. It was like the vision just disappeared. He was at work, and he was terrified. He drove himself to the emergency room, which I wouldn't recommend, but he got there, and we found that he had a blood clot in the artery supplying his eye. We were able to treat him, and his vision returned. But had he waited, had he thought, "Oh, maybe I need glasses," he might have suffered a full stroke within days. Instead, he got the treatment he needed, and he walked out of the hospital fully recovered. The fourth warning sign is sudden severe headache, often described as the worst headache of your life. Now, I want to be careful here because there are many causes of severe headaches, and not all of them are strokes. But I want you to understand that some headaches are different. Some headaches are accompanied by other symptoms. Some headaches come out of nowhere, and you can't remember ever having a headache quite like it before. This type of headache, particularly when combined with any of the other symptoms I'm describing, should be taken very seriously. This could indicate a hemorrhagic stroke where a blood vessel is beginning to bleed into the brain. The fifth warning sign is sudden loss of balance or coordination. You might feel dizzy or like the room is spinning. You might stumble or feel unsteady on your feet. You might have trouble walking in a straight line. You might bump into things or trip over nothing. This happens because the part of your brain called the cerebellum, which controls balance and coordination, relies heavily on a steady blood supply. When that supply is compromised, your sense of balance and spatial awareness becomes disrupted. I remember a woman named Patricia who called her daughter because she suddenly felt like she was falling even though she was sitting down. Her daughter immediately recognized this as potentially serious and brought her to the hospital. Patricia had experienced a TIA affecting her cerebellum. She was treated, and a few days later, she had a full stroke that would have been completely disabling had we not already been monitoring her. Instead, because we caught that warning sign, we were able to prevent the worst outcome. Now, let me talk about something that's equally important as recognizing individual symptoms, and that's recognizing patterns. Often you won't have just one warning sign. You might have a combination of them. You might experience weakness in your arm, difficulty speaking, and sudden dizziness all at once. Or you might have them sequentially over a 24-hour period. This clustering of symptoms is incredibly significant. When you see warning signs appearing in patterns, When you notice that multiple unusual things are happening with your body, that's when you need to take action. I also want to talk about some of the more subtle warning signs that people often miss. These are the signs that might not be as obvious as sudden weakness or slurred speech, but they're nonetheless important. For example, some people experience sudden confusion or difficulty concentrating. They might feel like their thinking is foggy or unclear. They might have trouble following a conversation or remembering what someone just said to them. This happens because blood flow to the parts of your brain responsible for cognition and memory has been reduced. Another subtle sign is sudden emotional changes. Some people become unusually irritable or emotional. They might cry easily or become angry over small things. They might feel anxious or panicked without any clear reason. This occurs because the blood flow changes are affecting the parts of your brain that regulate emotions. If you suddenly notice that your emotional responses seem out of proportion or unusual for you, that's worth paying attention to. Some people also experience sudden fatigue or weakness that goes beyond their normal tiredness. This isn't the kind of tiredness where you've had a long day and need rest. This is a sudden, overwhelming fatigue where your body just feels heavy and weak, and you don't have any obvious explanation for it. This can happen before a stroke because your brain is working harder to compensate for reduced blood flow, which exhausts your entire system. Now, let me talk about who is at higher risk for strokes, because understanding your personal risk factors is crucial for recognizing warning signs early. If you have high blood pressure, particularly if it's not well controlled, your stroke risk is significantly elevated. If you have diabetes, you're at higher risk. If you have high cholesterol, if you smoke, if you have a family history of stroke, if you've had a previous stroke or TIA, if you have atrial fibrillation or other heart conditions, if you're overweight or sedentary, all of these increase your risk. And here's what's important. If you have any of these risk factors, you need to be even more vigilant about recognizing these warning signs. You need to be more likely to take them seriously and seek help. I want to tell you something that might surprise you. I see patients all the time who experience warning signs and choose not to act on them because they feel anxious about overreacting. They think, what if I go to the hospital and it turns out to be nothing? Let me be absolutely clear. It is infinitely better to go to the hospital for something that turns out to be minor than to ignore a warning sign and miss the opportunity to prevent a catastrophic stroke. I have never, in all my years of practice, had a patient regret going to the hospital to be evaluated for potential stroke symptoms. But I have had many patients regret not going when they had the chance. Let me talk about what you should do if you experience any of these warning signs. First, the moment you notice something unusual, the moment you feel sudden weakness or numbness, the moment your speech becomes slurred, the moment your vision changes, the moment you feel sudden dizziness, you need to act. Don't wait to see if it goes away. Don't give it 20 minutes and then decide it's serious. Act immediately. Call emergency services. In the United States, that's 911. Don't drive yourself unless absolutely necessary. Get someone to drive you or call an ambulance. When you arrive at the hospital, tell the healthcare providers exactly what you experienced and when it started. This information is crucial. The concept of time is brain is absolutely real in stroke medicine. Every minute that passes without treatment can mean permanent brain damage. So time is not just important, it's everything. We have window-specific treatments that we can only use if patients arrive within certain time frames. If you experienced a warning sign and came to the hospital 3 hours later, you might have access to treatments that could save your life and prevent disability. But if you wait 6 hours or 12 hours, that window may have closed. I want to talk about something called the FAST test. This is an acronym that helps you recognize stroke symptoms quickly, and it's something everyone should know. F stands for face. Ask the person to smile. Look to see if one side of the face droops. A stands for arms. Ask the person to raise both arms in front of them. Check to see if one arm drifts downward. S stands for speech. Ask the person to repeat a simple sentence. Listen to see if the speech is slurred or strange. T stands for time. This is the critical part. If you observe any of these signs, it's time to call emergency services immediately. I use the FAST test with my patients, and I teach my staff to use it, and I teach families to use it. It's a simple, quick way to recognize that something might be seriously wrong. If you notice any of the signs in FAST, you don't need to notice all of them. Even one sign is enough to warrant calling for emergency help. Better to be safe and have it be nothing than to miss the opportunity to save your life or someone else's life. Now, let me talk about something that's equally important as recognizing warning signs, and that's prevention. While I've focused today on recognizing symptoms that might appear in the 24 hours before a stroke, the truth is that prevention is always better than treatment. There are things you can do to significantly reduce your stroke risk. If you smoke, you need to quit. Smoking is one of the most modifiable risk factors for stroke. If you have high blood pressure, you need to work with your doctor to get it controlled. If you have high cholesterol, you need to manage that. If you have diabetes, you need to keep your blood sugar in check. If you're overweight, you need to work toward a healthier weight. If you're sedentary, you need to start moving. I also want to talk about diet. What you eat has a profound impact on your stroke risk. Diets that are high in salt, high in saturated fats, high in processed foods, these increase your stroke risk. Diets that are rich in fruits, vegetables, whole grains, lean proteins, these reduce your stroke risk. The Mediterranean diet has been shown in numerous studies to reduce stroke risk. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, has also been shown to be very protective. Alcohol consumption is another factor. Moderate alcohol consumption, that's 1 drink per day for women and 2 drinks per day for men, has actually been shown to have some protective effects. But heavy drinking significantly increases stroke risk, so if you're drinking more than that, you need to cut back. Stress management is also crucial. Chronic stress increases stroke risk. The more stressed you are, the higher your blood pressure tends to be, and the more likely you are to engage in unhealthy behaviors like smoking or overeating. So finding ways to manage your stress, whether that's through exercise, meditation, time with loved ones, or whatever brings you joy and peace, these are all important protective factors. I want to emphasize something that I find is often overlooked in stroke prevention conversations, and that's sleep. If you're not sleeping well, if you're not getting enough sleep, you're increasing your stroke risk. During sleep, your body repairs itself. During sleep, your blood pressure naturally drops. During sleep, your brain clears out toxins that build up during the day. If you're chronically sleep deprived, you're putting yourself at higher risk. Most adults need 7 to 9 hours of sleep per night. If you're getting less than that, you need to make changes. Now, I want to circle back to the main topic because prevention is important, but today we're really focusing on recognizing warning signs, and I want to make sure that what I've told you today is absolutely clear in your mind. The signs that often appear in the 24 hours before a stroke are sudden weakness or numbness, usually on one side of the body. Their sudden difficulty speaking or understanding speech, their sudden vision changes, their sudden severe headaches, their sudden dizziness or loss of balance, their sudden confusion or cognitive changes, their sudden emotional changes, and their sudden unexplained fatigue. If you experience any of these, especially in combination, and especially if you have risk factors for stroke, you need to seek medical attention immediately. You need to call 911 or your local emergency number. You need to explain your symptoms clearly. You need to get to a hospital where you can be evaluated by a medical professional. I want to be honest with you about something. When you arrive at the hospital with potential stroke symptoms, you're going to undergo some tests. You might get a CT scan or an MRI. You might get blood work. You might get an EKG to check your heart. You might get an ultrasound of your carotid arteries. These tests can be uncomfortable, and they might seem excessive if your symptoms have resolved. But they're absolutely necessary. They're how we determine whether you've had a TIA or a full stroke, and they're how we determine what treatment you need to prevent a future stroke. I've had patients who felt silly coming to the hospital because their symptoms went away and then testing revealed that they had definitely had a TIA. They were treated, and a major stroke that might have otherwise occurred was prevented. Those tests and that hospital visit potentially saved their lives. So even if you feel better, even if your symptoms resolve, if you experience sudden symptoms like the ones I've described, you still need to get medical evaluation. Let me also talk about a condition called atrial fibrillation, because this is particularly important for stroke prevention and warning sign recognition. Atrial fibrillation is an irregular heartbeat where your heart rhythm becomes chaotic. When your heart is beating irregularly, blood doesn't flow through it as efficiently, which increases the risk of clot formation, and clots can travel to your brain and cause a stroke. Many people with atrial fibrillation don't even know they have it. They might feel like their heart is racing or beating irregularly, or they might have no symptoms at all, but they're at significantly elevated risk for stroke. If you're over 65, you need to have your heart rhythm checked regularly. If you have any history of heart disease, you need to be monitored. If you experience sudden palpitations or notice that your heart seems to be beating irregularly, that's something you need to discuss with your doctor immediately. And if you have atrial fibrillation, you likely need to be on blood thinners like warfarin or the newer anticoagulants. These medications significantly reduce your stroke risk if you have this condition. I want to talk about the emotional and psychological impact of having warning signs or a stroke, because this is something we don't talk about enough in medicine. When someone experiences a TIA or survives a stroke, there's often significant psychological trauma. There's fear about it happening again. There's anxiety about being alone. There's sometimes depression related to the changes they've experienced. If you've had warning signs or a stroke, I encourage you to seek psychological support. This might be therapy, counseling, or support groups. Taking care of your mental health is just as important as taking care of your physical health. I also want to say something to family members and loved ones who are listening. If someone you love is experiencing warning signs, be their advocate. Take their symptoms seriously. Don't minimize them. Don't let them convince you that it's nothing to worry about. Get them to medical attention. Be present with them. Support them through the process. And educate yourself about stroke risk factors and warning signs so that you can help protect them. Let me tell you about my patient James, because his story really encapsulates why I'm speaking to you today. James was a businessman in his early 50s. He had high blood pressure that he wasn't aggressively treating because he felt fine. One afternoon, he experienced sudden weakness in his left arm. It lasted for about 15 minutes and then went away. He thought it was strange, but he didn't go to the doctor. He thought maybe he had slept on his arm wrong. 2 days later, he had a massive stroke that left him partially paralyzed and unable to speak clearly. He spent months in rehabilitation. He had to learn to walk and talk again. He wasn't able to return to his business for nearly a year. And the terrible part is that it was preventable. That 15 minutes of weakness was a warning. Had he responded to it, had he gone to the hospital and been evaluated, he likely would not have had that massive stroke. But James is also a testament to the power of rehabilitation and the human spirit. Through intensive therapy, he regained much of his function. He's back to work now, though his life is different than it was before, and he's become an advocate for stroke awareness. He tells his story to anyone who will listen. He wants other people to learn from his experience so they don't have to go through what he went through. I want to be your wake-up call the way James's stroke was meant to be a wake-up call. I want you to take this information seriously. I want you to recognize that your body is trying to communicate with you, and I want you to listen to what it's saying. If you notice warning signs, act. Don't wait. Don't hope it's nothing. Don't convince yourself that it's probably fine. Act immediately. If you don't have warning signs right now, use this information to protect yourself and your loved ones. Talk to your doctor about your stroke risk. Ask about ways you can reduce that risk. Make lifestyle changes if necessary. Get your blood pressure checked regularly. Make sure your cholesterol is in a healthy range. Exercise regularly. Eat well. Manage your stress. Sleep enough. Do everything in your power to prevent a stroke from ever happening to you. And finally, share this information. Tell your family about the warning signs. Tell your friends. Post about it. Make sure people in your life know that if they experience sudden weakness, sudden difficulty speaking, sudden vision changes, sudden dizziness, sudden severe headaches, sudden confusion, they need to seek help immediately. You might literally save someone's life by sharing this information. You might be the reason someone calls 911 instead of dismissing a warning sign as nothing important. So, I want to thank you for listening today. I want to thank you for caring enough about your health and the health of your loved ones to learn this information. I want to encourage you to use what you've learned here. I want to encourage you to be an advocate for stroke awareness, and I want to ask you to do something for me. If you found this information valuable, if you think it could help others, I encourage you to subscribe to my channel so you don't miss future content about stroke prevention, neurological health, and other vital health information. Leave a comment below and let me know your thoughts. Share your experiences if you've had warning signs or a stroke. Tell me how this information has helped you. Your comments and engagement help me reach more people with this crucial information. Together, we can increase stroke awareness, we can help people recognize warning signs, and we can save lives. Thank you so much for being here today.